I am Adekoya, representing Children That Change the World Ogbomoso at the Gold Youth Development Agency Pre-Implementation Training. I have the privilege to speak a little about the issue of adolescent pregnancy and different views that have been out there in recent time. Yes, as a medical doctor that deals with children and adolescents, as a community-based organization lead that also coaches children and adolescents, I would say in all honesty, abstinence is the best to prevent the physical, mental, emotional, psychological myriads of things that happen as a result of premarital sex. Gold Youth advocate for long-term committed relationships in the absence of premarital sex. However, we would not always have this ideal situation because there are myriads of things that expose youth to premarital sex, which most of the time is usually beyond day alone. There's a complex of things from the environment to parenting system to family structure, peer pressure, environment, and all of that might not make it easy for them to suddenly stop to their engagement with premarital sex. That might not make it so easy. Of course, for some they can break away easily from these things, but many of the time it doesn't come that easy. And we have to admit this. We have to admit that some were sexually exposed, sexually molested, and some of these things have become obsession based on the web of events, that the way the brain operates and all of that. It might not be so easy for them to just suddenly break. So what we advocate for is to make them know the choices available. That look, abstinence remains the best. However, as they are making their journey to social behavioral change, as we hold their hand, mentoring them, guiding them, we should also let them know we should let them know the choices available. We should not ignore the reality. For instance, the use of condom to prevent sexually transmitted infections like HIV and the rest of them, to prevent adolescent pregnancy, to prevent unsafe and illegal abortions, and to prevent children that would be born into repeated cycle of hopelessness and other menaces. So I believe that we should not just look at it from an angle, maybe just from the religious angle, but we should uphold them into making social behavioral change. For those who are not yet exposed to premarital sex, we should encourage them to have a conviction that abstinence is the best. However, for those who have not been able to attain this, because of the fact that they have not attained this, does not mean we should not let them know. And at the end of the day, the choices is theirs. They are well educated, they are well informed, and they can make their choices and have a good